Hello, my dear friends, once again, Pavel Krastev, DDS, New Hyde Park, New York. Welcome once again. Today is a very big day. We started out with Dr. Keanu Shar and Dr. Jeremy. They did a wonderful presentation. Then I hosted Dr. Bilham, and well, that was another really great presentation on socket grafting. And hey, it's been a great day so far. And I feel very honored because usually Global Summits keeps me in the basement. They keep me kind of like in a cage with the beautiful women. And today, I'm going to introduce a lovely lady from Washington, D.C. Her name is Dr. Claudia Cotca, a lovely colleague of ours who's very accomplished and will share some great wisdom with us. Before I formally introduce her, a couple of things, guys. We encourage all doctors, all healthcare professionals to join the D2 movement. Nominate yourself, nominate a friend, join us. We'd love to hear your wisdom, your knowledge, share with our fellow colleagues. Again, the knowledge that you possess, it'll be great. The other very important thing is we're doing relatively something new. You can get CE credits. So there will be a link posted in the comment section where you can attain your the certificates at the end of the show. Let's bring on Dr. Cotca to the stage. Dr. Cotca, welcome. It's a pleasure to meet you. You're in Washington, D.C., as I understand. And I really look forward, as well as the audience, I'm sure, to your wonderful presentation on this very exciting topic of oral systemic protocols and medical devices in dentistry. So that's going to be quite exciting. I'm going to go through Dr. Cotca's resume, folks, and gradually then we'll turn over the presentation to her. Okay. So let me get again my spectacles on. By the way, today, I'm getting ready for the shows, and I start putting cologne on. So I said to myself, what are you putting cologne on? You're going to sit in front of your computer. So I'm trying to figure out, do you do a better presentation with cologne on or without cologne? I don't know. But I'm going to try to get to the bottom of this and figure it out because, sometimes like when I freshen up, I feel better, more energetic. So, I'm going to do like a test run. But anyhow, so ladies and gents, please meet Dr. Claudia Cotca. Dr. Claudia Cotca is a three-time graduate of the University of Michigan, where she received a Bachelor of Science with a chemistry degree and cellular molecular biology, a Master of Public Health in Toxicology, and a Doctor of Dental Surgery. Dr. Claudia Cotca, an international lecturer and aesthetic restorative dentist, founded the Washington Institute for Dentistry and AMP. Laser surgery in Washington, D.C. Metro, a private practice institute, and the C3 think tank, an innovative real-time protocol incubator where she develops real-time oral systemic aesthetic advanced clinical protocols and medical devices. Dr. Claudia Cotca serves on the ADA Standards Committee on Dental Products and as USA delegate to the International Organizations of Standardization, among many others. She serves as an editor and reviewer of various oral science journals and is a fellow of the American Academy of Oral Medicine, the Pierre Fauchard Academy, International College of Dentists, and a member of the International College of Prosthodontists. She has been an active expert on Capitol Hill in testifying before the United States Congress and the White House, as well as a dental expert and contributor with ABC, NBC, and healthcare industry sectors. Media press kit and AMP. Speaker invitations and requests can be emailed to author@claudiacotca.com or World Wide Web, claudiacotca.com. So, Dr. Cotca, welcome. And it's a great pleasure to have you. Thank you for taking our invitation and joining us today. And we look very much forward to your presentation. And at the end, we'd love to hear from our audience and take some questions, perhaps. So welcome. Tell us a bit about yourself. Unmute, please.
Thank you so much for having me. I appreciate very much the generous introduction. I know there was a little slight technical difficulties earlier on. It has been, first of all, a pleasure to join this particular unique platform across the globe. Thank you from Washington, D.C. Of course, Washington, D.C. is an international representation of sorts. So with that, we have not only the nuances of what constitutes the movement of organizations and countries and such and so forth, but also aspects which very much impact the healthcare sector. It's been a pleasure for me and a privilege to be able to journey to Washington, D.C. from University of Michigan as a student. I spent 10 years there. And I had long prior to that experience at Michigan, wanted to develop essentially innovations, but not necessarily focus on reinventing the wheel, but rather appropriately add in function of the necessity of time and the demand with respect to the advances that oral medicine and other interdisciplinary aspects of the healthcare demands from the population perspective. And so it's been almost 2 decades, and dreams were prior to that. So I have been living dreams, and I hope to continue on doing so. So there's much more to accomplish, and today, hopefully, our audience will have an opportunity, for those of you who don't know me, to learn or to tap into nuances and details which they very well may be exposed to. However, with the movement in terms of healthcare sector today, it is more evident that as clinicians, we need to partake into everyday decision-making processes which do integrate and necessitate those type of variables, which render more, better clinical outcomes for our patients, not just, diversified as the population and the phenotype of the individuals are, but also in terms of the transfer between the different demographics, the different geographic locations, and with globalization and other incredibly innovative and creative terms, sometimes we think we are really reinventing the wheel, when the fact is that we need to look to see where things historically have been missed. We need to improve them, and particularly think about time-dependent access to serve our patients at large.
I guess it's all about, as you said, the patient care and treating our patients properly and giving them the utmost and highest quality of dental care that we can possibly give them. So look, let's rock and roll. Let's turn the podium over to you, and we look forward to your lovely presentation. And thank you once again for accepting our invitation. So the floor is yours.
Thank you very much again. So
Pleasure.
With that, yes, go ahead. I like to go, may I share?
Please do.
Thank you. So as briefly touched upon, having been in Washington, D.C. has given me impeccable, I would say, view of the transaction of different variables within the healthcare sector. And the reason why I wanted to bring this topic to our conversations, not just from I would say different demographic perspective where you find yourselves all over the world, but also from a global perspective. And so today, again, my thanks goes to Top 100 Doc platform. And to you, the audience, I like to just say that this is going to be an informal discussion, an informal presentation, if you will, perhaps a little bit nuanced differently, but one that very much aims to enhance your perspective on how we evaluate clinical protocols, particularly when we consider innovation or development, as well as how we look at technology and medical devices in dentistry. And so with with that, I'd like to just disclose that I am the founder of the institute here in Washington, D.C., 2 different institutes. All the photography, all the clinical protocols have been developed here on site, as well as on the organization. I should disclose also that I am a clinical protocols and medical device consultant and KOL, variety of industry and institutes collaborations, as well as we are a teaching institute, and so one of the interests for me has been advanced oral systemic clinical protocols, and of course, all the rights reserved. Our sponsors today are, I should say, laser microsurgery at DC as a dentist, as well as the platform for global leadership in dentistry and sciences, the past, present, and next generation. So with that, I'd like to tap in very quickly into the objectives so that we can have a clear sense, albeit a plethora and nuance and diversification of the subject matter we're going to be discussing today. My interest is to just give brush strokes of the clinician's global perspective for protocols and medical devices in dentistry. This lecture will not focus on the sequela or the representation of all the classifications of protocols or medical devices in dentistry, but really aims to highlight, if you will, and I'm going to borrow an example from mathematics, the nuance and the differentiation between a proof and a formula, whereas the proof really has the overall matrix of bringing all the constituents and variables together, and all the nuances of the movement, albeit no matter what the scenario. And whereas the formula really is generating a certain outcome, but in function of dependent and independent variables. And so with that, I will go into specific examples so that the message is carried clearly. And if you would like to, of course, always interrupt for clarity, I'm very welcome, and I welcome your questions. Having recognized and identified the importance of advanced oral systemic protocols, which essentially are very different than the systemic, than the symptom-driven clinical protocols. There is a categorization, differentiation between the two. One constitutes mechanism and the other really constitutes the presentations of various different variables. And the derivation of the clinical sequence, if you will, depending on which variable one is interested in. Of course, time and demand, significance, and acute versus chronic makes a difference in terms of which approach is appropriate at that particular time. But for longitudinal perspective and stability, particularly in a set of population, either in private practice or in public practice, or for instance, in the organizational level, looking at the clinical protocol derivation and function of diagnosis and interdisciplinary variables and systemic profiles, with the understanding of the clinical toxicity index, which is not often discussed or mentioned in our conversations in dentistry, with, of course, the therapeutic index of therapy, which is oftentimes discussed in dentistry. This will be introduced today, and will be hopefully enhancing your appreciation, not only for your own knowledge, but also for the opportunity which each clinician has wherever they are placed, irrespective of the dynamics of the clinical demands of the case. Thirdly, and I'm sorry here, the sequence is incorrect. The third objective is really to just recognize the pathogen, the pathophysiological process of disease, and to understand again the highlighting of the clinical toxicity and the oral systemic principles, meaning why treatments fail. And there's no better example for me to give you, albeit there are plenty, than the COVID-19 aftermath, where or the COVID-19, I would say, equation of sorts, which essentially brought the terminology comorbidities in every conversation, expert including non-expert. And with that anticipation, the other part of the balance, if you will, just opposed to the clinical protocol, is really the technology. And so we're going to discuss medical device position, the selection, the integration, and of course the application. Examples will be laser microsurgery and also standard versus different magnifications. And the last but not least will be the appreciation of the adaptation of the correct disease assessment approach, which I always make the case not only increases the clinical outcome of your own population of patients, but also protects in longitudinal stability of the population health in reducing the comorbidities, meaning that the type of patient rendition of phenotypes and clinical outcomes represented as phenotypes in the population, in your own population, in your own clinical setting, will actually ultimately render and has a radius of impact, if you will, within the community, which also extends horizontally, and then of course will be, I would say, inter-exchange from a geoposition perspective. So I hope that this will be all backdrop to the reality which we as clinicians are always faced with. Patients present with chief complaints. Majority of the time, motivation renders from the aesthetic perspective. And from our perspective, of course, my own position is that aesthetics always follows function. And I'm sure you would agree with me that in the rendition of the assessment for patients, we are motivated to understand and to incorporate the various components of advancement of technology, of advancement of science. And with that, I think the impact on the rendition of the clinical outcome matters significantly. And I like to just highlight two examples from the most recent years. I've already mentioned the COVID component, why the rendition of having considered or having to consider all the nuances of what constitutes clinical protocol development. How do we bring clinical protocols that are effective to the market? And how do we mirror those with technologies that actually do what they say they do? And I've recently, in a lecture, I've highlighted to a student lecture in Romania, if you can't recognize it, if you can't see it, you can't treat it. And with respect to the COVID example, Dr. Kenserota, for instance, interviewed me on 7 different series actually on the COVID. And one of the things that I would say we would all agree with is the following. The precipice between patient and doctor relationship, the access to care belongs and has to be protected. And I would say combination or the making a case for clinical protocols and making a case for technology advancement has to take in consideration and has to give that protective access. And we've seen that actually has been compromised or at least limited. And of course, we're not getting political here, but just being accurate, it has been limited by other parties or other variables, when the reality is that we clinicians actually do parlay as the first tier access from patients to the rendition and to development of, or I would say the application of clinical protocols and technology. The other case I'd like to make for the reason why the topic is actually very important, not just again by a clinician that's accepting clinical protocols or that is accepting the technology, but also for a clinician that actually is involved in the development or wishes to involve or to develop an advancement, is the following. You may all know the Theranos story, where Elizabeth Holmes some years ago essentially wanted to do real-time protocols assessment of a blood sample with respect to comorbidities. And we know that capital was raised for, I would say, over 500 million. And she really had incredible backup from all aspects of the sector, which moved and really brought to the, I would say, the front line of attention from the medical sector. The reason why I bring this example up is because we know very well as clinicians, because we see patients every day in our practice, and we see them all over the globe. I think this platform is well represented with an international representation of sorts, because we have access to that differentiation, not just the localized population here in United States or Washington, D.C., but also all over the world. You realize that there are necessities, there are certain phenotypes, certain abnormalities, certain comorbidities, even in the oral areas of sciences or dentistry that have yet not been conquered. And yet there are other attentions in other areas where there's a lot of movement, if you will, a lot of penetration to the market, whereas some very necessary and important demands for therapeutics, for clinical outcomes that actually not only are effective, but also longitudinally stable, really are almost, I would say, dead in the water from the very beginning for various different reasons. And as clinicians, we have to, I would say, take a very active participation in not only incorporating what we know, because we are aware and we are taught well in our curriculum and doing the academic preparation, but also in the practice and the evaluation of medical devices, which we all as clinicians practice when choosing any type of protocol that we render, whether it's PROS, whether it's oral medicine, whether it's endodontics, whether it's oral surgery, and so on. So with that, the development of the advanced aesthetic oral systemic protocols really ought to be differentiated as mechanism driven rather than the systemic compilation of variables, whereas 9 different, for instance, variables could render a collection of representation of protocols, as opposed to a mechanism rendition of recognition will, of course, easily transfer into the appropriate solution identification and then the execution. The notion of the technology that we actually have, we of course trust that industry keeps up with our skill set and with the demand of the populations that we receive. I like to just go very briefly in terms of my own journey, in terms of the participation as a clinician from the rendition of the clinical protocol, the choices of treatments and therapy options as I read the therapeutic demand of the patients. And so for those of you who do not know, of course, I strongly believe in magnification and therapeutic protocols. We know, for instance, that there's the oral component that we all focus on. And I think that in the curriculum aspects, we've been taught to be even more specialized, if you will, even more detailed, if you will, within the various disciplines of dentistry. But that component is always linked to the systemic nuance. And the reach or the root component of variables of cause and correlation that go, I would say, cause that actually go beyond correlation, actually go into the actual reach of the development and the layer by layer system, if you will, of the rendition of the disease, the pathophysiological process of disease, does cater the understanding and the contribution of readout from systemic profiling patients in real time and in the clinic, as well as the optimization for the actual protocol. And so my own interest peaked when I was at Michigan, University of Michigan, in legislative aspects of how can we help position clinical protocols in more effective timeline. We know that, for instance, consensus white paper, as an example, oftentimes take decades to be rendered, to be coagulated, to be cross-checked, if you will, for all the experts to really agree on the position. And that oftentimes actually trickles out and filters out nuances and variables that actually are very viable in the time-dependent reality or present where we find ourselves. disease doesn't wait for consensus positions, and there is a complete time and place for those particular demands and for the particular guidance. However, I'll give you an example. Having my background in public health, I monitor annually the genomic mutational level of my population here in Washington, D.C., as well as in the United States. And so the CDC has an incredible richness of data to depict and to identify which, for instance, gene pools or which gene categories are actually active in the population. And I would say, for instance, in the last decades, a lot of attention and a lot of the data indicate that there's a mutational increased frequency, for instance, in oncogenicity, in the tumor suppression aspect, as well as CYP450. CYP450 is essentially an enzyme that metabolizes medications. Now, interesting enough, we know that our population has gone through significant medications, I would say, distributions and aspects of integrating medicine as part of a normal regimen of therapy. Where it can be argued that it ought to be looked at as a bridge, and the aspect of the clinical protocol intervention or the surgical intervention or the therapy intervention that involves the clinician in real time can, of course, allow for the patient to reach more health, the health phase, and maintain it, but without having to be dependent on an external synthetic or natural exogenous compound or exogenous element. Moving on, and I don't want to stay too deeply into each because there's a lot of detail to be shared, but the large picture, of what would constitute, I would say, adequate position to be able to evaluate things effectively, quickly, by demand. We, for instance, have noticed here in Washington, D.C. Metro that there is a incredible increase in the development of the manifestations of the crossover symptoms between rheumatoid arthritis, for instance, manifestations in the oral cavity, as well as, for instance, SLE, lupus, or Sjogren's, let's say, much higher rates that have been 5 years ago. And with the appreciation for the evaluation and keeping in, I would say, in sync with the realities of the data. Again, data is incredibly important, and raw data is incredibly important. As clinicians, we have been prepped and we have been educated to read that data, even outside of our immediate discipline, but that have impact, and they have an absolute rendition into the equation of the rendering so that the clinical outcome is optimized. And with that, the core sciences for me have always contributed a great deal of insight in terms of the protocols, particularly as I look, for instance, at the technology of laser, optical laser, and optical physics technologies, where the understanding the physics of light interaction with tissue can render various different nuances of I would say, results, which is significantly different from the conventional counterparts. I had of course, have always been involved in the innovation thread, and I've had the pleasure also here participating with the Harvard University Oral Systemic Think Tank, Systemic Health, that focuses think tank that focuses on oral systemic health manifestations of the systemics in the oral cavity. This is an example, for instance, of participating in a panel with the focus of targeting diabetes and the diabetic profile and nuances of how the actual characteristics of the pathology in the oral cavity renders differently as opposed to the ASA1 patient. The point of this is really to bring to light, I would say, more convincing encouragement for each of us as clinicians, rendered by the nuances of differentiation. My background is, for instance, is in public health and toxicology, in addition to being a dentist and an oral science, I would say, or oral clinician, if you will. In this particular example, I've testified before United States Congress on laser protocols in the context of the opioid crisis and opioid legislation. As an expert, representation here at the FDI level of AOM, for instance, renders a certain integration of the geoposition or globalization aspect, for instance, of protocols. But again, I'm not a fervent, I would say, believer that, patient X at such a geoposition level or in a certain location, is best treated by, clinician Y, halfway around the world. In a sense, it does constitute back to the necessity for the local clinician to actually take the position from a global perspective of integrating the nuances which actually affect their communities in real time. And here I am, for instance, in being involved with the, this is with a coalition. I represented my organization in the Tobacco-Free Kids Bill, which later was passed into the bill. And of course, rendering language in terms of the legislative language, in terms of the necessities, and all these nuances, and many more examples, the audience, I'm sure many of you have already been integrated in one or two or three of these particular activities, and yet there's a plethora that compilates the healthcare sector, which as an expert and as a clinician, we need to essentially have roots and representation in the nuance of the matrix. Even albeit we are very focused, in a specialized way. However, there comes a point in time where we are faced with the development of clinical protocols, we're faced with the development of medical devices, and the incorporation of the other sectors that interact with healthcare, or the other subsectors that are part of the healthcare, make an incredible requirement for the optimization of our activities in that sense. And so with that being said, when we look at for instance, development and improving innovation, clinical protocols are obviously a necessity. With that, the partition really and the movement or the correlation between the two has to be with the industry. And as experts, we have to be essentially gatekeepers in terms of what type of technologies make it to the market, the adaptation and the motivation for accurate representation of technologies. As a consultant, for instance, we of course here evaluate technologies. And so we look to see, does the technology actually do what it's meant to do? Just because I'm taking a transition from or I'm looking at technology that has been placed on the market and launched as the new technology, and yet all it has done is taken a analog, right, translation and moved it to a digital. However, the digital output has not been improved, has not really motivated and put us to a higher, superior category of rendition that is closer to a optimal clinical protocol as compared to the previous. And, with respect to, I would say, the differentiation, the choice selection, one of, for instance, of the points I was making at a lecture at University of Michigan, my alma mater, in the last 2 years, the curriculum at the dental school, I believe up to 20% has actually been motivated and modified to incorporate the public health perspective in the clinical decision-making processes and teaching that concept. Of course, we've done this for the past 17 years here in Washington, DC. But my point is that there is a movement which is inevitable to incorporate the nuances which have an impact on the derivation and the decision-making processes for innovation in the therapeutics as well as the medical devices. And clinicians in the private sector, and my case is always made as such that clinicians in the private sector are actually a very large majority chunk of the equation. majority of the population, and I would say probably in majority of perhaps a large representation of the global presence, are receive therapeutics directly from more the private sector component. Albeit the large organizations or larger medical spaces are of course seeing more chronic renditions of systemics. But when we look at the for instance the oral sector of science, of healthcare, dentistry, we actually have a very unique position and opportunity, because we have an autonomy, and a lot of other, I would say, countries within or with the representing the oral sciences or the dentistry, they have an advantage over the systemic healthcare platform to actually move quicker, to be more creative, to incorporate things more effectively or efficiently. And the private healthcare practitioners have an incredible fundamental participation in that sense. So more specifically, and of course, what I want to say, this is not where the capture of the representation stops. I just took a few variables, and I may touch upon a little bit more later, but this is just a brushstroke introduction as to bring awareness, and I hope to convince how important it is to partake active involvement, because as clinicians in private sectors, we actually do customize clinical protocols in the healthcare settings wherever we are. So with that, when we look at the clinical protocols, of course, we look at the innovation, the funding capabilities. We are, of course, very familiar with funding capabilities for large organizations. However, at least in the United States, and I know that also in Europe and other parts of the world, there's been a huge transition in the past 10 years, 15 years to allow for the what can be rendered as the competition and maintaining competition, maintaining superiority and excellence on the rendition of therapeutics, therapeutic development, as well as medical devices and technology, from and to substantiate a more smaller or again, entities which can move differently and move more creatively. And of course, they can address nuances that large organizations just don't have either the scope, the vision, or the implementation factor that they typically would focus on. So with respect to the legislation aspect, there are, of course, differentiation in terms of the various different borderlines and legislative borderlines across the globe. But the ANSI and the ISO, for instance, have been, I would say, an important guidance in terms of reflecting on the cross-check of how effective really is the technology, how I would say robust is the development. Is it following a guidance standard that actually has been tried and has been scientifically rendered? So when we look at technologies, I want to see those type of references which give me, of course, a certain amount of confidence. We don't, for instance, in the private sector, we don't just render medical devices or medications or, for instance, certain utilization without having an approval by the organized bodies like FDA and other organized bodies, OSHA, for instance. So with that in mind, I would say that the nuance of the last 5-10 years in the systemic and the comorbidities, I would say, collection of presentation in the population has been exceptionally diversified. Whereas I would say 20 years ago, when I was in the, in academics, or I was just journeying through the journey of learning, there was a much more larger homogeneity in the presentation of the phenotype. And yet that has changed tremendously. Now, with that being said, we all love these studies that are, have large cohorts, populations, typically more than 500. But I would say that the case studies are equally important in the derivation and I would say the reference and the announcement and of what is happening in the specific geoposition where the manifestations occurring. And one of the areas, for instance, of my own interest outside of lasers is temporomandibular disorders. We know that those type of comorbidities, if you will, or pathogenicity of TMD have always been married to OSA development. However, there's been just a very slow movement and adaptation, to the healthcare sector that's being implemented, that's being distributed to the patient population, such that we basically see trends of phenotypes of abnormalities in the population, not just locally, but also across trends globally, where we see that there's just big pools of abnormalities that have not been treated, in a larger, with a higher incidence of stability, higher incidence of clinical output with maintenance, if you will. So my interest is always to, for instance, utilizing the example of magnification versus standard evaluation. As I mentioned to you earlier, if you don't see it, if you don't recognize it, even though visually is not as, is not as clear, is not as differentiated, and yet it has to be recognized, then you can't treat it. And so, my own particular, let me go back, please. My own particular position has been the assessment of the correct disease phase has to be there in order to have clinical optimal outcome. The technology has to be, of course, chosen correctly and combinatorially, if you will. And knowing that this increase in the clinical outcome onset not only protects, of course, in terms of the local population of the entity of the practice, but also translates into a stability of population health in reducing comorbidities. And for that reason, I always say, by definition, that private health actually is public health. And, with that said, when we look at the clinical protocol medical device, a combination of advancement and movement, the nuance of what actually we have to go through is, from the oral systemic protocols, which are clinical protocols, all the way to, of course, technical requirements and technology, both from a diagnosis perspective as well as a rendering perspective. But to get there, there's a lot of in-betweens. And to have these two components not only correlate, or not correlate is the wrong word, but integrate effectively and penetrate the market at the right time, so that there's a distribution of the clinical outcomes that really has aspect and remuneration. And mathematically, we can, of course, tap into understanding of how large of a matrix this actually is. The in-between make it, there's a lot of variables that do have to be considered. They do play an incredible role, but we as clinicians, not as, I would say, out of the equation as perhaps historically we have been, or perhaps we've been recommended to be. And what I mean by that, and of course, here I've already touched upon the legislation as for the regulatory, the non-governmental organizations, both at the global sense, WHO, UN, but also the more local sense, the local representations as well. The consumer sector renders an incredible impact on how quickly a technology is adapted and how quickly an oral systemic protocol is adapted. And the R&D community taps in, of course, to the temperature, if you will, or the atmosphere of all the variables that I've mentioned, including the geoposition. And we know that, for instance, with globalization, and I know that there's a lot of positives about globalization and about the translational aspects, if you will, of knowledge and adaptation. At the same time, there's a uniqueness of rendering that only the local component can really address effectively. Why? Because they are familiar with it and they are basically integrated with it. And the reality is that for an effective oral systemic protocol to be rendered, or technology to be rendered in the most optimal impact on a population, all those nuances do play an incredible role. And recognizing that they do and incorporating the decision-making process and the movement and the navigation of, if you will of course, gather that. So another example, clinical speaking, for instance, I mentioned earlier, the coordination of the visualization. We have here, for instance, an actinic colitis, and we have the present here. And again, this adaptation to this was done with a CO2 laser in a very unique fashion, while not losing any type of volumetric loss. The component of modification of the laser technology, optical lasers, and the packaging renders an incredible impact on the clinical outcome. So when we say, yes, practice lasers, lasers are an incredible technology that have to be understood. And albeit, I would say with great disappointment, they've been available for decades, and yet they have not had the proper position in our subsector of medicine in oral health as they ought. And one of the areas that I would like to see more improved from the coordination of that approach is, of course, from the equipment side, the packaging, having a microscopic visualization, as well as with the integration of the capability of a laser as opposed to a scalpel, which differentiates to the tissue layer capability. And yet we have these type of applications in other subsectors or other sectors, if you will, and yet in healthcare, particularly in oral health, the integration of those combinations have been stagnant. And so with that, one of my, for instance, this is just an example of what one of my favorite combinations here is the Global GoPro Duo. I particularly enjoyed the technology adaptation of that. And one of the areas of interest for me, because of the fact that we have over 6 different wavelengths at any one time here at the Institute, I would like to see a more, I would say, sophisticated package of integrating the filters, if you will, or the capabilities of integration between magnification and laser technology. The medical sector, the large medical sector, enjoys that access. Oral and high sciences applications, clinical protocols in dentistry really has yet to really have a taste of what actually the technology discoveries that have been available for so long actually can render for our patients. And that has massive impact in so many different phenotypes that when we look at the compilation of what constitutes comorbidity or what constitutes a failure, what constitutes an infection, it's a layer by layer by layer by layer system. And one of the reasons why I study toxicology is because I wanted to really understand, how does the host respond fail? How is it that certain clinical protocols render an amazing clinical outcome in the appropriate time designated, and yet others do not, or the same protocol in a different population does not? And so that recognition of seeing how the host is deficient, being able to identify the variables of that deficiency and recognize accurately from a mechanistic perspective is really what gives the key to the clinical outcome. So again, with that, I think we're bringing up to a wrap. I like to just, of course, pardon the error here, but I hope that it has raised your motivation to render yourself as you are experts in the areas of training that you've received in that extends outside of the specific application, of the exercise of the protocol, but rather you have been trained and you have been prepared and equipped, in understanding the other variables, and particularly if you're interested, in advancing clinical protocols for your patients, in coordination with cross-check of technology and medical device development, those, I would say, pairings and that sensitivity for the evaluation, for the decision-making process, with every clinician is exceedingly important and exceedingly impactful, not just, of course, in your community, but also across the globe. So with that, I hope that we've made at least an introductory case for why mechanism-driven advanced oral systemic protocols are actually more effective and can be more effective, not just, of course, theoretically, but we've seen a lot of, I would say, observational and also studies that have actually shown that, identify the diagnosis and function of the interdisciplinary variables, the systemic profile, having an appreciation for the newer term, I would say in dentistry, the clinical toxicity index, which basically renders the index of comorbidities and the characterization of those, as well as, of course, taking consideration the therapeutic index of the therapy itself, and that's really in rendition with the technology. Not to say the least, the technology selection, the integration of the application, laser microsurgery, albeit there's a myriad of technological representations of how dentistry has benefited from the technologies of the world, if you will, and yet there's really, I would say we have a unique opportunity in dentistry as opposed to the medical profession at large to move in different rhythms and, of course, much more effectively and synergistically. And with that, making the case that the decision and the realization, the decision that we actually have as clinical practice providers actually does render a public health component impact in the local community as well as translationally across the globe. So with that, I'd like to give it back to Dr. Kraskov, and of course from the Washington Institute for Dentistry and Laser Surgery in Washington, DC, USA. I thank you for having me here.
Dr. Cotca, that was a fantastic presentation, very informative, and I took some notes about a couple of things I'm going to throw on the table that came to my mind. But certainly, thank you so much. It was wonderful, and we'll take some questions at the end. But you know what? When it comes to manufacturing and large corporations, and you know, there are companies, and the reason. Let me give you a little background. I'm one of the KOLs for Helmut Zeff GmbH in Germany, and they produce, design, produce, and market some of the finest dental instruments in the world. That's really set the bar for the global dental community. And the problem is that I notice, at least in my humble opinion, is that there's many companies that go and copy these reputable companies that really make quality products that are well tested and put to all the rigid standards before we can use them on patients. So how do we handle on a governmental level all the copycats? I mean, you know, it's not fair because these big companies, as I said, Zeff, I know for a fact Helmut Zeff does very serious testing and hardening of instruments, and you know, they really go all the way to provide us with instruments that are just superior. And you know, I thought that's important for the future. What do you think of that?
So I'm not an attorney, although I did before law school, and I was a law clerk for an IP firm while I was studying at Michigan and my master's, primarily because I wanted to, of course, understand how do we protect, how do we position effectively, and how do we ensure that the recognized efforts, right, are rendered to the correct parties. You know, it is a larger, I would say, answer. However, some of the decision-making, I would say, logic would constitute, of course, the combination of the strategy of the patent itself. For instance, I used to do a lot of 312 amendments. I don't know if any of you know what those are in patents, but basically, essentially, we look for how do, you know, how before the patent actually is fully launched, etc. Can we improve the patent during the, you know, that has been submitted while the process of the examination has been rendered. My comprehensive, I would say, answer to you is combinatorial. It would start with the strategy of the patent and the strategy of the IP approach. About 20 years ago, I would say, or 30 years
I'm sorry,
ago.
Can you just do me a favor? Can you just stop sharing your screen so you can pop back up?
Yes, of course.
Just stop sharing. Yeah, great. Oh, thank you so much. I'm sorry for that. Please go ahead.
Yeah, so I would say that it has to do with the strategy of intellectual property. And there has been a significant change in the last 10 years in how do we protect innovation. You know, the larger corporations, talking about the Fortune 500 companies or Fortune 100 companies, Fortune 50 companies, they do intellectual property very different than the rest of what is being understood. And so the strategy merits incredible attention to ensure, and there have been massive developments to actually render that very thing. There are things that we as clinicians, as innovators can do as well, and I'd be happy to go in more detail. I think it would deserve a lecture all in and of its own, just on that subject alone.
Absolutely, and I'll take you up on that, and I hope one day we can meet each other and perhaps we'll have dinner together with some other friends and we can talk at length about these ideas and some of the things that I'd like to share with you. So listen, that was really great. Before we open the question session, let me just read. There's one special event coming up that I'd like everyone to know, and I don't want to forget to mention it, so just give me 1 second. There's going to be a special little offer. Okay, just bear with me. Okay, so the International Extraction Academy, guys, is going to be doing a hands-on workshop, which is going to be Saturday, July 31, obviously 2021, in Rancho Cucamonga, California, and Saturday, September 25th. 2021 in Irvine, California. And guys, they're offering a 50% discount. So I mean, I didn't want to forget this. And please, I mean, if you forget everything else, remember the promo code. So the promo code for 50% off is AOS 2021. Very simple. Academy of Oral Surgery, AOS 2021. You get 50% off. All right. So that's Saturday, July 31st and Saturday, September 25th. Promo code AOS 2021. All right. Having said that, I thank you once again, and let's see if we have some questions from the audience. And again, I look forward to meeting you in person one of these days.
Looking forward to it.
Any questions, guys, ladies and gentlemen, everyone in the audience? We'll give you guys a minute if anyone would like to post anything. I guess not. So, Dr. Claudia, it's been my pleasure and my honor to host you today. And thank you for sharing such valuable information with our audience. And once again, to you and to all moms out there, happy Mother's Day. And you guys, moms are number one. I miss mine very much, but moms are number one always. So kiss your mom today. I love you all.